Good evening, Mindful Elevation viewers. Welcome again to another discussion that we're going to be having. Tonight, we're going to be talking about fertility and all what comes with it, and of course, our reproductive system, the good and the bad, the difference between men and women, how we can check it, and much more. So, tomorrow, Sunday, April the 18th, is the National Infertility Awareness Week in the US. So it is a good topic that we're going to have today and also connected with this week, even though it's not the week for all countries and everywhere, but still it's good to mention that because then on your own country you might be able to bring more awareness about that as well. So during this hour, we're going to be talking with Miss Wendy, and she is a licensed clinical mental health counselor. And we're going to be sharing and discussing about this topic. So, good evening, Miss Wendy. How are you doing?
I am so good. Thank you so much for having me. It's wonderful to see you today.
Thank you. Thank you for accepting my invitation.
I'm honored. Thank you.
So, can you let me start with asking you if you can tell us a little bit about yourself?
Oh, absolutely. Like you said, I'm a licensed clinical mental health counselor. I am in the state of North Carolina on the coast, so in the southern part of the states. We have some beautiful beaches. We can get from here to the mountains within 6 hours. I have been a clinical counselor for 21 years and have really had a passion and a specialty in reproductive health for the last 18. So.
Okay. Okay. And how come you decided to go in that area of the reproductive health?
That is a really good question. I started in child trauma, and when I ended up starting my own family, experienced reproductive health issues myself. And after recovering from my own fertility trauma, went on to explore, do my own personal work, and just immerse myself in all the training I could find with reproductive health. And so here I am.
Nice, nice. That is really interesting because, and we need indeed professionals that have that information so they can educate and inform everybody. So I really appreciate that.
Yes, absolutely, because you would probably be not surprised at how many people get to me after struggling for several years, and it just breaks my heart that they get to me later in the journey than at the beginning of the journey, because there's so many routes we can take as far as helping folks out to decide what direction they're going to go.
Yes, exactly. So why is it actually important to know about that topic?
Mm. Yeah, you and I were talking about that before we went live. Coming from a child trauma specialist, it's really important to start that conversation about reproductive health, body parts, body knowledge from birth. So on the changing table, recognizing just body parts early and often, and it takes us right straight through on into young adulthood. So I'm a big fan of starting conversations early and often. It protects children from sexual abuse. It gives us knowledge and power on our reproductive health, our fertility. And I think you and I were both talking about, there are some things that I wish that I had have known as a young teenager. So.
Yes, exactly. Because the more informed you are, the better it is indeed.
Absolutely.
For you to make your informed decision. So
Absolutely.
yes. So when we're talking about fertility and all what comes with it, what the reproductive system have to do with it, or can you give just a synopsis about what it is? We can dive into the topic.
Absolutely. I don't know about there, but I know here that there's this misconception, this myth that reproductive health or fertility is a female responsibility or a female issue. And that is not the case. I mean, it's pretty much 50-50. There's 40% can be a female factor or female issue, 40% can be a male factor or male issue. And then the other 20% can be unexplained or a combined issue within the reproductive system. So with the females, it could be blocked fallopian tubes, it could be fibroids in the uterus, it could be endometriosis, it could be polycystic ovarian syndrome, truly diseases of the reproductive system. For men, it could be a varicocele or something wrong with the sperm getting to where it's supposed to be. So really within the reproductive health system, it's a 50-50 issue.
Okay. Okay. Yes. And then how it is that we might be able to go about that. So because of course, let's say even at my age, I might not know a lot about it. So how can I go about it? Or maybe we even have to start, like you said, from when you're born.
Exactly. Having those conversations early and often, especially, excuse me, with parents, having those discussions on, how to protect their fertility. What is fertility? What is reproductive health? And we can definitely combine that with respect to people's, spiritual beliefs, with their religious beliefs. So physical, emotional, sexual, spiritual, financial parts of self are all so relevant in these conversations, from birth to children, to adolescents, to young adults. I'm a huge fan of encouraging the parents that I work with and having those conversations with their children. So by the time they are young adults, like 17 to 19, that they are having these delicate, important conversations with their doctor, whether it be their pediatrician, their primary care physician, or their obstetrician or gynecologist, so they know what fertility awareness is. Like you and I were saying, if I had have known, I could have taken steps much earlier to combat some of the issues that I had myself. So
Yeah.
knowledge more early and often.
Yes, indeed. So how it does go in the States then when it comes to education in this area?
Are you asking where it starts in the States? As far as we do have what they call a health curriculum that starts in the 4th grade. So they do 4th, 5th, and 6th grade, and then 7th and 8th grade, and then that's it.
Okay.
That's it. And if I could get in there and do some of my magic, yeah. It needs to continue through 9th, 10th, 11th, and 12th grade.
Yes, correct. Because that's the age too that you're turning into a teenager, all kind of changes, and it's important for you to know. Yeah, that's true. For over here too, I would wish that we would pay more attention to this topic as well, because it's an important part of the human being. And then especially for the girls, that if you don't know how your body works, what for impact it might have, even when you're going to have sex, then you might give in everything, and then not being able to how you call it, take good care of your body, or
Absolutely. Because
decision.
sexual health is more than just fertility and reproductive health. It's consent. It is understanding. It's kindness. Communication is kindness. We have to be able to communicate this information to our children, to our teens, to our young adults, so they can make good decisions.
Yes, exactly. And how it is that we can check our fertility. You mentioned before, for example, you have endometriosis. How it is that we are able to keep track of our fertility system, reproductive system, and to make sure that everything is okay, or be able to detect it in an early stage.
It's a really good question, Rhonda. Like you and I said before, having those conversations just about body in general and safety and consent in general. However, and I'm going to say not everybody agrees with this, but it is a forward movement. We are getting to this place where we have our adolescents, like 17 to 19, 17 to 21, who are starting to have fertility checks. So being able to get a basic fertility checkup, talking to your family practitioner or your gynecologist. So they will run basic tests, which is a blood test or hormone swab test, such as a dye test to check to see if the tubes are open. They will do blood tests to check your hormones. So there are certain hormones that are higher or lower with folks who have polycystic ovarian syndrome or with endometriosis, like super, super bad cramps. That I won't go into all of that today. We can do some of that at a future time. But there are basic tests that you can do that so many folks that come to see me haven't had them until they're like 30, 35. Even 25, I think, is too late. I think we need to start implementing regular testing as early as 17 to do it. Like my niece, for example, was diagnosed with polycystic ovarian syndrome. Luckily, her auntie is in reproductive health, so I'm pushing this, and she was diagnosed with polycystic ovarian syndrome. So now at 19, we can effectively, work to combat that, and that diagnosis isn't necessarily an infertility death sentence. We have the tools, we have the information, we have the lifestyle changes that we can really educate her on. Whereas if she had have gone, they'd have slapped her on birth control and we'd have gone until she was 25 or 30, we wouldn't be having the same conversation.
Yes, exactly. Because it's like you said, if you do not know what to ask the doctor for, you will never get those type of tests. Or unless you're feeling like a heavy stomach ache that doesn't go over, then you will not know what question to ask. You will not get the appropriate test, and then it will continue lingering till maybe when the time reach for you to want to, for example, having babies, then then you figure out it might be too late.
Absolutely. So I feel like we really do need to promote basic testing, even if we just start out with some blood tests. I mean, you and I were talking about beforehand, just uterine fibroids and how the prevalence of that is so high. So, and if we look for these things early, then we save people heartache and a lot of anxiety and depression.
Yes, exactly. Exactly. So when it comes to your profession as being a mental health counselor, and you more in the direction of the reproductive system, so in cases like this, for example, that you might have women coming to you, I assume in just indicating, okay, I have been trying for several years, can't get pregnant, then what do you do?
Another good question. I follow the American Society for Reproductive Medicine's guidelines. So if someone gets to me and they just don't know, and they are under 35, I will have them talk to their regular OBGYN. If they're over 35, I will say, have you talked to your OBGYN about going to see a reproductive endocrinologist? Because as a mental health provider, I'm not a doctor, I don't want to drive in the lane of a doctor. But if I'm hearing something that is like, whoa, they should have been at a reproductive endocrinologist office yesterday or 5 years ago, I'm going to be direct about that. What have you talked to your OBGYN about? And have you heard of a reproductive endocrinologist? So
okay. And then what do you do to give out those type of information? I mean, now it was like an individual coming to you, but then how can we bring that awareness to the general public that okay, for example, over here, yes, it might be something that you don't talk about it in the open, but it's like you said, it will prevent a lot of anxiety and stress by a lot of women if there might have been.
I would encourage folks to ask their living relatives, and if they are adopted or donor conceived, I would say, at least look through and see if you can find any medical history about your mother, your grandmother, your aunts, both sides of your family, to try and see, what is your medical history, and ask your family, do we have any sort of fibroids in our family? Do we have any sort of miscarriages or loss or pregnancy issues or postpartum issues. So definitely ask your family first and then your primary care. And if I'm not mistaken, tell me if I'm wrong, Barbados has a main reproductive endocrinology clinic, and then they have some satellite clinics in St. Martin.
What they have in St. Martin, you said?
It was an IVF clinic, so a reproductive endocrinology clinic. And even though it's an IVF clinic, it does not mean you have to have IVF. It means that there is a board certified reproductive endocrinologist in St. Martin.
Yeah. Because the reason why I ask is indeed to kind of like bring that distinction that, like you said, not because you have the IIV clinic, yes, but it's more that you have a doctor that is licensed in that can give you information and
Yes.
show you the steps.
Yes. Most obstetricians and gynecologists will refer to an REI or reproductive endocrinologist for things such as thyroids, polycystic ovarian syndrome, endometriosis, or unexplained fertility issues.
Okay.
And for the men, they will send them to a urologist.
Okay. So in the meantime, in between, we have a question. Are reproductive issues a growing problem, or have they always existed, but we didn't have the data?
That's a good question. They have always been an issue. I think that the more technology and the more awareness and education, such as what you're doing, getting the word out there, more people will get the help that they need, and we will have better diagnoses. So.
Okay. Yeah. And you just mentioned about the men. If there's anything, they go into a urologist. What type of challenges a man can encounter for them to have to go to a urologist when it comes to fertility?
So for the gentleman, they look at a sperm analysis. They will look at count. They'll look at morphology. They'll look at motility. I'll take a varicocele, for example. So a lot of folks here, I can read that to you. So you have to have healthy sperm in order to create a child, which we know. And the sperm being carried into the semen, there has to be enough sperm in the semen. So that's the count. And they have to be able to function and move. So the motility. So if the motility is abnormal, then they may not be able to get to the egg or even penetrate the egg. So some common medical causes are like a varicocele, which is a swelling in the veins that drains the testicle. But that's super treatable. They do a surgery, and that can be easily corrected. It could be an infection, and you and I were going to talk about lifestyle. So some sexually transmitted infections can cause some infertility. Let's see. Hormone imbalances. Guys are affected by hormone imbalances just like us ladies are. So.
Yeah, yes, because that's one of the questions two questions, because the first one was so because male is correct me if I'm wrong, is during the lifespan it's created sperm, and so then what will be of influence on the sperm not being able, like you said, not having the enough count,
So guys are constantly creating sperm. They create sperm until they're 100 if they're living long. However, their quality declines like ours does. So by the time and you're going to have to fact check me on this because I'm not a urologist. However, by the time a guy is 45, their offspring, it goes like tenfold, if I'm not mistaken, for autism, schizophrenia, bipolar disorder. So the quality of the men's sperm declines with age, even though they continue to produce offspring. Whereas us with the eggs, we're born with all we're going to have. And then by the time we are 35, 24 is peak. 24 for us ladies is peak prime fertility. And it slowly starts to decline. So about 35, you see a marked difference. By the time we're 40, really, it could be quality and count for eggs. And by the time we're 43, we're at the end of that childbearing.
Yeah.
Now, are there people who have children naturally at 45? Sure, I see that. But your percentage is probably going to be less than 2%.
Yeah. Okay. And then you mentioned about men having hormone imbalances as well. So can you explain that a little bit? Because I'm getting some comments that how is it that men have hormone imbalances as well?
Well, I'm going to leave that up to a reproductive endocrinologist or a urologist, which I am not, but they have hormone issues just like we do. So testosterone, there can be imbalances with testosterone, which is more than just their sexual function. It deals with their heart. It deals with a lot of our whole intricate endocrine system. So,
okay. When it comes to the lifestyle that you briefly touch on, what for impact can it have on the fertility of a woman and a man?
Men, yeah. So infertility is a disease. A lot of people think that, if they just relax or, they're too stressed out. While stress does impact some of the ovulation pieces, it is more of a disease of the reproductive system, whether it be male or female. Which came first, the chicken or the egg? Was the stress cause infertility, or does infertility cause stress? So the jury is still out on that. However, we do know that infertility does cause stress. Like I said a second ago, stress, we don't want to blame people. We don't want to blame people for being too stressed out, or you shouldn't have had that dairy, or you don't eat this, or you don't do that. It's really a disease. You can't relax enough to get rid of a disease. But there are some lifestyle factors that are very important, like smoking, vaping, toxic chemicals. So there has been a link, which has been, you can fact check me on this for years now, the link between the phthalates, the plastics, chemicals in our water that really are not prime for fertility.
Yeah. So then in a way, if those type of things have an impact on the fertility, then the future doesn't look so bright when it comes to that, because it's a lot of plastic, it's a lot of toxins going on in the world.
They're endocrine disruptors, correct?
Yes, exactly. And then so if you get a client by you and you realizes that, like you said, you don't know if the chicken or the egg, but let me say that because of the stress, it has an impact on her fertility or reproductive system. So how do you go about that then with that client?
We do a lot of mindfulness-based activities. So whether stress causes infertility or not, we know that a mindfulness-based lifestyle is going to be helpful for us anyway. So we are not going to be perfectly balanced, but we can strive for living the best that we can. So balancing that mind-body connection. So the brain is part of the body, and I definitely believe, as far as just in my practice and with the research out there, that it's super important to try to live the most mindful way that you can. It doesn't mean that we always have to be positive, because that breeds toxic positivity. But we certainly can feel our feelings, embrace them, acknowledge them, because when we do that, it gives us that power to walk through and have that more balanced mindset. So and then affirmations does not cure infertility, but it certainly gives you the coping skills to get through it.
Yes, exactly. Correct. And then do you get clients as well that have been trying and maybe even went to an IVF doctor and still can get pregnant? So do you get those clients as well? And then in a case like that, because I can imagine that is not something easy to handle and deal
Right.
with, and then how you go about a client with a client like that.
That is a really, you're so full of great questions, Rhonda. That is, yes. So at that point, people decide, do we want to live child free or do we want to look at our other options? But before we look at our other options, we have to address the grief around that. Because once we get to the end of that road and we look at donor egg, donor sperm, donor embryo, adoption, surrogacy, we really have to honor the grief that's associated with that. So yes,
Okay.
I do see many clients who struggle with, okay, we've spent 10 years trying for our own natural child. Do we want to be child free and grieve that and move forward and live a happy, healthy life? Or do we want to look at adoption? And adoption is not a cure. Adoption is a calling. So when someone says, oh, you can just adopt, that's like, oh, like a stab to the heart, because, we don't want to be shamed for that not necessarily fitting your family or our family idea. And that's okay.
Yeah.
People don't have to adopt, because adoption is not a cure for infertility. It is a calling. And so I walk
Yes.
people through all of the grief around what their next steps are.
Yeah. And then I can imagine that that process for everybody, as in the grieving is different for everybody. Yeah.
Absolutely.
Yeah.
Absolutely.
And then and it's an important thing to know too, that not because as a women you didn't bear a child, as in you didn't get pregnant and the child didn't born, it means that you might not be suffering or you might not be grieving. So oftentimes, if we don't see the, let me call it the illness, the disease, or whatever you want to call it from outside, that it's kind of like crippling the person, then it doesn't exist. Then why it is that you're grieving or that you're sad. So I think
You
it's
never know
important.
what someone's story is. You don't know the shoes that
Yes,
they've walked in. Yeah.
exactly, exactly.
That's
And
why I'm a big fan of having conversations with people that don't involve where they work, do they have kids, how many kids they have, because you don't know what their story is. And if all we talk
yeah,
about in the society and our culture is, oh, so do you have kids? When are you having kids? How many kids do you have? It's hurtful. It's hurtful.
yeah. Mm-hmm.
Let's
That
talk
is
about
that
some
is true.
other fun things besides how many kids you do or don't have.
Exactly, exactly. I think as a community, we need to start coming up with a list of different topics to talk about.
Exactly. Because some folks are child free because they want to be, not because they've
Yes.
struggled with infertility, but because that's what they want in life. And that's great.
Hmm.
So,
Correct.
mhm.
Correct. That is true. And that also we have to respect. And so and not break them down or see it as something negative.
No
So
judgment. Hmm.
correct. Correct.
Hmm.
So what are some myths around fertility?
Say that again.
What are some myths around fertility?
Some myths around fertility are that it's a female issue and that it's rare with the men. That is a huge myth. Because, like we said before, it's 40% female, 40% male, and
Hmm.
20% unexplained or combined issue. Let's
Yeah.
see, what are some other myths? Some other myths are that same sex couples can't have kids. So there's lots of technology out there where people can have kids. Single women can have kids. Single men can have kids. Our same sex couples can have kids. Let's see, what are some other myths around fertility? Those are probably the largest ones, and especially single folks having kids, because everybody's having kids. Who wants to have kids? We
Yeah.
have the technology these days.
Yes, correct. That is true. Is it a challenge? I mean, because of the myth, it might be a challenge, but when it comes to, let's say, the legal part, as a single woman, is it a challenge for them to, what's the word I have to use here? Conceive, because normally conceive is between a man and a female, but
Mhm.
is it a challenge to conceive, as in are they, let's say, allowed to go to, for example, an IVF clinic because they're single, they want a baby, or is it something that they reaching to all kind of barriers
Mhm.
because they're single and the society think that it's best to have.
Sure. So that's where the physical, emotional, sexual, spiritual, financial parts of self come into play. So the single people that I work with, I help them navigate. Okay, so have you had your fertility checkup? Is everything working properly? If so, you will be able to use IUI, which is intrauterine insemination. You can just go to your OBGYN's office, you purchase your donor sperm, you have that with your OBGYN's office. You don't necessarily have to go to a reproductive endocrinologist's office unless you have a fertility issue, which if you have blocked tubes or if there's something else going on, then you may need the assistance of a reproductive endocrinologist to address those issues as well. But most of the time, my single women by choice can just deal with their OBGYN.
Mm-hmm.
And
Okay.
I ask them, okay, so let's brainstorm this. What is your support system going to look like? Do you have somebody to help you postpartum? Do you have a doula? Do you have a postpartum doula? Do you have the finances in place? Do you have daycare in place? Because being a single by choice person comes with it, a lot of those extra barriers that sometimes we don't think about.
Mm-hmm. Correct. Correct. And then if a person will answer you no on majority of those questions, is that something that you will coach them in it as well?
Right. Surround yourself, look for other people in your tribe that can help you, assist you, talk to them, let them know what you're doing. Who can you trust, friendship
Mm-hmm.
wise, family wise? Are there other women in your community or other men in your community or other people in your community that can give you that physical, emotional support? I'm a huge
Yeah.
fan of postpartum doulas.
Okay.
What's
And
the doula, what's the doula community like where you are? Do you have a large doula community?
a doula is like what you call them? Not a nurse, but the one that guides you through your pregnancy
That
period
helps
and
you through.
after, right?
Hmm. Hmm. Hmm.
Yes. Um, I know that on some of the other islands you have,
Hmm.
and if I'm not mistaken, you have here as well, but it's not. Of course, it's not in a large quantity.
Okay. There's a
So,
girl, if you want to look her up on Instagram, Erica McCarthy, and she
mm-hmm.
actually runs a doula training.
Okay,
She's amazing.
nice,
Hmm.
nice. Yeah, because I mean, from the experiences that I hear from women that gave birth, especially after it's really challenging for them because of the whole new they have to, yeah,
Postpartum, ooh, it's no joke. That's another thing
yeah,
I wish I would have been taught is postpartum is not the same for everyone. And the postpartum
mm,
depression and anxiety is more than just the baby blues. And I think it's important for us to teach that in middle school and high school, not just how not to get pregnant, but what it all looks like across the lifespan. So, fertility,
yeah,
pregnancy after loss, because recurrent miscarriage and recurrent pregnancy loss is also a form of infertility. Postpartum anxiety, postpartum depression, perinatal anxiety and depression. I mean, it's all so valuable and important, and we really need to be
hmm,
teaching our young people.
yeah, exactly. And especially because from young age they, I mean, not all, but some of the youth are already suffering from depression, and then after that it might even get worse kind of
Yes.
thing. So
Absolutely. Because if you have a history of depression and anxiety, we need to keep an eye on you because you're at a higher risk postpartum. Because I mean, even with the teenagers you and I are discussing, the teen pregnancy rate, even though it is declining, there are teenagers that are having babies and their postpartum anxiety and depression rate. I mean, we have to keep an eye on everybody. We have to
yes,
face and care for all of us.
Yeah. And it's like you said, when it comes to the young females, as in the teenagers,
Mhm.
they bounce faster back. No,
Mhm.
let me flip this.
Resilient. They're very resilient.
Yes,
Hmm.
but what I meant is more that their body bounce back faster, but then you still don't know mentally what it does do to them, because for them it is, I cannot go and show my friends that this pregnancy was hard, is difficult, and even after the birth is extremely difficult. I need to put up a brave face. I need to pretend like it was happy and
Hmm.
everything.
Hmm.
So
The stigma's
yes.
already there. You're right.
Correct.
Hmm.
Correct. That is true. That is true.
There's so many topics on reproductive health across the lifespan. We could talk about it for hours. There's so many
Yes,
different layers. So,
exactly. Exactly. Do you think that because for a teenager it's really, they go have sex, most of them, some of them don't use protection, so the next day they go and get the morning after pill.
can be.
But even when some of them does get pregnant, they decide to stop the pregnancy.
Mhm.
Do you think that that has an impact on them as well? Them stopping the pregnancy, kind of like when a women. I mean, it might not be comparable, but when a woman has a miscarriage, you
Mhm.
know that you need to pay extra attention, because mentally, physically, it might not be 100% extra care. But do you think that for youngsters that decide to break off the pregnancy, that it has impact on them mentally as well?
Absolutely. I see so many folks who come in and are struggling with shame and trauma related to their infertility journey because of a termination or abortion. And they feel so responsible, like this is their punishment. And so we
Mhm.
really work on managing that grief and that shame and that guilt so they can move forward and live a happy, healthy life. Because to say that someone is being punished because of something that happened, it just, yeah, it breaks my heart.
Yeah, yeah. Do they come out of their, let we call it, own free will by you, or are they being referred to you by doctor or maybe schools when it comes to teenagers?
Mhm. I have multiple referral sources. So I've been in my community a while and I was a school teacher before. So I get referrals based on word of mouth, but I do get referrals from OBGYNs, reproductive endocrinologists. I have referrals from, other families, other parents, other school counselors. So I do get quite a diverse variety of referral sources.
Okay, okay.
Mhm.
When it comes to okay, so we kind of like brushed on the, when it comes to the mental health, and it does have an impact on that. When it comes to the couples,
Mhm.
and because majority of the time we talk, if we're talking about that topic, we're talking more from the women perspective.
Mhm.
But then now, how about the men?
Mhm. When I see couples when they are dealing with infertility, if it's a male female couple, oftentimes the men get lost in the shuffle. So
Mhm.
they feel like, and they've culturally been taught, societally, they've been taught that they have to be the rock, they have to be the person to take care of their significant other, and then their grief gets overlooked. So I like to spend a lot of time with my gentlemen and partners on, how are you? Where are you in this journey? You matter as well. So I know we're
Yeah,
focusing over here, but let's focus on you a little bit. And you see just the relief and like, oh, I can have a voice too. I'm part of this partnership as well.
yeah. Mhm.
Absolutely, you are.
Yeah. So what tips can you give to the women when it comes to that area, when they going through that, and then they have a man that, like you said, because of how the society have been raising them, they don't share emotions, they don't really communicate. But then, as a woman, you don't want to be losing the relationship neither, and it's for you, it's something that might be bonding you more, but then because of maybe lack of communication. So what tips or maybe tools can you give a woman when they go into that?
One of my favorite resources is the five love languages. So
Mhm.
I usually send my folks off with a copy of that. So the five love languages are words of affirmation, quality time, acts of service, physical touch, and gifts. And gifts don't necessarily mean buying you something. It could be picking you a flower off the side of the road. But if we look at and understand, and you can take the free quiz online, and I don't get paid for promoting this book. This is just one of my favorite resources as a therapist.
Yeah.
But it is short and sweet and to the point, and it talks about people's different love languages. And if for us ladies, if we know what our partner's love language is and they understand what our love language is, and we start speaking each other's love language, we're on the same team, whether it be through an infertility journey, whether it be through a stillbirth or pregnancy loss, postpartum, we are on the same team. Things aren't always going to be rainbows and unicorns, but if we understand that there's a light at the end of that tunnel and there are tools, communication is kindness, five love languages, there is a light at the end of that tunnel, we'll make it through.
Yeah. That's true.
Mhm.
um in your case, what would you have wished to know before?
Yeah. What would I have wished? That there's more to reproductive health than birth control and not getting pregnant. how to how to there's so much gender communications, um, consent, kindness, just the communication piece. So
Mhm. Yeah. Yeah, exactly. So you agreeing to that in general self, that has to be way more the same as we communicating about cars that we can buy, and how many discount we can get, and every week there's another car show. This is
communication.
yes, this is a topic as well that we have to be talking about, because it's too much women and men suffering under this.
Yeah, we
It's
need to teach young men about women's minds and bodies. We need to teach young women about women's minds and bodies. And for those
mhm.
who don't gender conform, I mean, just being able to teach that, you know, humans are humans. So,
Yeah, yeah, exactly. And that is very important because
mhm.
if we don't know that, hey, we humans, and especially nowadays, because of everything going on in the world, and actually, I'm not only talking about pandemic, but just how the world have been evolving, and all kind of influence and everything. That yes, we can. It's not only anymore that you're getting a cold, but a lot more things coming to play a part in how you're feeling mentally, physically, and everything.
Yeah, and just being able to teach our young folks that those feelings are natural and normal. And when it comes to acting on those feelings and protecting your sexual health, so take sexually transmitted infections, for example. Some sexually transmitted infections will completely block your tubes, and you won't know this until you're much older and you end up not being able to get pregnant. So we're
Yeah.
not going to be able to convince young people to embrace it, but we can plant those seeds because just
Hmm.
developmentally they're not able to be on top of all that. But if we are constantly planting those seeds from birth, just early and often, sex wise families, um, let's see, the mama bear effects. There's several really good resources. Just
Hmm.
learning and growing along with them. By the time they're 21, 25, it'll click. It'll click.
Yeah.
And then we'll be fully developed. I'm like, oh, that's what they were teaching me all this time.
Mm-hmm.
Plant the seeds early and often. It will click. It will pay off. I promise.
Yes, yes. I think we need to go look at our education system, and I'm talking from based on the islands. We need to go look at our education system to see how we can incorporate that more than it already taking place,
Mhm.
because like you said, maybe not at that moment it will click, but maybe later on, and then especially the teenagers might be able to make better
Yes.
decisions. Yes,
Because if you're
exactly.
talking about it in fifth grade, sixth grade, seventh grade, those seeds are planted. They're going to be reflecting and thinking. So in eighth grade, ninth grade, 10th grade, the choices will be a little different.
Yes, especially because you have the peer pressure, and
Mhm.
then you are informed about how your body works, what the consequences are, and everything, and then you can make a better choice than to just give in, and then later on having to go think about what you want to do and what not.
Yeah.
So
Informed consent, informed decisions. That's it.
yes,
Layer
exactly,
upon layer. Mhm.
exactly. Tell us a little bit about the male infertility, because
Um,
I think we watched a lot about on the women part, but the men, you can't leave them
um,
out.
so we talked quite a bit about the sperm issues as far as the mental health piece.
Mhm.
Oh, yeah, a lot of the guys that I see, the shame and the guilt, I think it weighs really heavy on them because they feel like, oh my gosh, this was my manhood. I'm supposed to be able to do all of these things, and I can't produce an offspring, or my family is going to have to use donor sperm in order to build a family. So they struggle with the shame and the guilt. Mhm.
Yeah.
What we
And
put on them societally as far as masculinity.
yes, I was going to ask, how do you go about that as a counselor? Because besides the fact that fertility is not a topic that is really out there, and then especially when you have it on the men's side that you are, for example, infertile, and
Mhm.
how do you go about that?
Mhm.
Because you know the general thing is not all men, but for them it's a little bit more challenging to express themselves.
Mhm. Mhm. First, by acknowledging that this is not their fault, that society has kind of put them in this box to be the end all be all rock, and that this is a safe space, that it doesn't have to be that way. And a lot of times it's like with the love languages. I'm not encouraging them to be, emotional and mushy gushy, but speaking to them through what their love language is, or encouraging them to talk to their partner through what their love language is, not what their partner's love language is. And so really just acknowledging and embracing, where they are, just where they
Yeah.
are. Mhm.
Yeah. And is that something that it open for, or is it with a lot of things that's going on that those ones that are more open will come by you, but then those one that have a little bit more challenge to understand that they can express themselves as well might not come by you?
That's a good point. I do what's called an intended parent consult. So folks who are utilizing donor sperm, donor egg, or donor embryo have to see me before they can embark on utilizing donor gametes. And a lot of times when they get to me for that, I'll talk about that piece, and you just see the look of enlightenment come across their eyes. So if I get them in that way, they're very amicable, very open to it. If perhaps they get to me through another route, which is their partner drags them in kicking and screaming that, okay, we're having these issues, we have to talk to somebody. That can be a little more of a challenge. But usually by the time they're with me,
Mm-hmm.
they're relieved, because I try to speak their language and just really
Yeah.
honor where they are. So
Okay.
I'm like, oh,
Okay.
this isn't what I thought it was going to be. This isn't bullying me or blaming me or shaming me. I'm like, no,
Mm-hmm.
I'm here to meet you where you are and just walk the walk with you.
Yeah. Mm-hmm. So then, once they kind of like understand that they can talk about their feelings and express their thoughts,
Yeah.
um,
Then they're all in. They're like,
okay, so
why did
even
I do this a year ago? Mm-hmm.
okay. So then they are also more open for doing the IVF and because if the ego plays a role by them, I can imagine that having to use another male sperm to insert in the women, that might play
Mm-hmm.
kind of like a role as well.
It is. We do a lot of grief work around that because what's happening is you are grieving the loss of, it's like a death of your genetics and passing on your genes to your child.
Yeah. Okay. Okay.
And we
Do
talk a lot
you
about that.
Okay. Do you see couples no. Do you continue seeing couples that started by you and at one point you went to do the IVF,
Mm-hmm.
got pregnant, child born? Um do you see there as well that because they went by you, it's especially when we're talking about the men, that they accepting the child, they later on in life they don't have no challenge because it's somebody else's child.
Okay. So that is a developmental process.
Mm.
And what we talk about before they're pregnant is probably not going to be in their head 10 years from now, 20 years from now. So I tell them, I'm here for you for this journey. So whether you need me a month from now, 5 years from now, 10 years from now, hopefully I'll be here. But I try to talk about the developmental aspects of what that child may be going through. So what we call donor conceived. You and I could have a whole 2-hour conversation on a donor conceived child. So in the intended parent consult, I will work with the parents on what their grief looks like. But how do you tell your child has been donor conceived? You know, are you worried about, are they going to hate me? Are they going to say, you're not my real dad, you're not my real mom? So we talk about all of those things. And there's some amazing books and resources for donor conception. So the Donor Conception Network. There's a lady here in the States out of Texas, Jana Ruppnell, who wrote a full book on donor conceived kids. So there's so much good information out there.
Yeah. Yeah, that is really nice. We just have to be able to find those make use of the
Yeah.
information that are there.
But that is natural. That is a natural response for parents to say, well, I love the kid. Will the kid love me? Am I their parent? And so we have a good 30-minute conversation on nature versus nurture. And you know how blended families are. I don't know if you have somebody in your family that's been adopted or donor conceived, but I mean, most people can pull from experiences either with friends or with other family members, and I kind of weave that into their story because really it's their story and their child's story, and we talk a lot
Yeah.
about
Okay. Okay. And then, so then the surrogacy mother falls in kind of like in that category as well.
that. Mhm.
And then, of course, is the men and the women being having to do the grief and everything.
Mhm. So my same-sex men have to use a surrogate. It can be a known or an unknown through an agency. I don't know in St. Martin if it's altruistic surrogacy or if there's paid surrogacy, but we do have different types here. And there's a very tight protocol in place to protect parents, children, and surrogates.
Okay, okay. And then in a system like that, it's based on what they decide if the surrogacy mother can continue staying in the life of the child, or is the system over there that it's literally only surrogacy mother once the child is born, that's it, no contact.
Usually here we do not do traditional. We do not do traditional surrogacy where you're using the surrogate as well as her gametes. Usually it is a surrogate and the mother's egg or a donor egg. And we talk a lot about that in the evaluation with surrogates. And if we talk a lot about attachment and the parents versus the surrogate. So it's a very in-depth, oh gosh, it's such a deep and wide process, and we could talk about that for a whole another 2 hours. But
Mhm.
they run a very, very tight system as far as legal, ethical criteria to protect surrogates, their families, and the parents.
Okay. So then, if I understand it, in a case like that, then the surrogacy mother is involved in, let me call it, a counseling as well.
Yes, they do an intended parent consult. They do a full psych evaluation on a potential surrogate, and then they do what is called a joint interview with
Mhm.
family, all the families members involved with the surrogacy and the intended parents
Okay.
to make
Okay.
sure that there's no miscommunication, to hammer out any type of physical, financial, emotional issues.
Okay. Okay. That's good to hear. Do you get clients that, because you mentioned at the beginning that after 42,
Mm-hmm.
practically you don't have, as a woman, you don't have eggs anymore. But then of course you have, you still are able to get pregnant. So you get clients as well that, let's say, are over 44, 45,
Mm-hmm.
getting pregnant,
Mm-hmm.
might have, how you say that, not schedule that in because that sounds so bad, but I can't come up with the correct wording. But
But
okay,
like
yeah.
a chromosomal issue. So what happens is we may be able to get pregnant with our own eggs, but there's a chromosomal abnormality that the pregnancy isn't viable. And so usually after a certain age, like 40 to 42, they'll offer donor egg.
Okay, okay.
Mm-hmm.
Mm.
Mm-hmm.
And then all of that is, of course, uh, what is the word, not paid for, but all of that you can do through your insurance as well.
That depends because insurance here varies and is different by state to state. So that's a whole nother topic.
Yeah. Okay.
Because we really struggle to have some even basic infertility things paid for because it is a disease, but a lot of times it is not paid for.
Oh, okay.
And I
Okay.
encourage, I mean, I'm not pro or con egg freezing, but I will talk to if I have younger like college students who say, you know what, my Aunt Sally had a baby at 45. I'm just gonna wait. And I'm like, okay, well, absolutely. We want you to be able to have freedom of choice. Look at your career, look at your grades, look at a partner, whatever you want to do. But also think about that your egg's age. It doesn't matter if you're the healthiest, most fit 42-year-old on the planet, your eggs are not, and you are born with so many. So if folks are interested in egg freezing, I give them a ton of information and send them to the reproductive endocrinologist office so they can make an informed choice. Because if you freeze eggs early, it's not a guarantee, but it is an insurance policy that if something happens, that you'll have it. Just like with cancer patients, they will go ahead and freeze eggs or embryos so they can go through their treatment.
Yeah. Mm-hmm.
Mm-hmm.
Do you do this? Do you give information at schools as well?
No, we're not
Okay.
allowed to. I wish I could.
Oh, okay.
I have two teenage girls, and so I pump as much information as I can into them and say, go tell your friends.
Yes. And what might be the reason actually?
With the schools,
Yes.
because they have a curriculum in place.
Ah, okay, okay. Yeah,
Mhm.
I
One of my
understand.
friends is a sex educator, and I ask her about it all the time. And she's like, "I know we need to update this." I'm like, "Come on, let's do it. We need to update it." So,
Yes, exactly. Even over here too, even if it's a 1 or 2 sessions you come and share with the students, that is already something, like you said, information is key
mhm.
and
Yeah,
communication is key. And
that's it.
so,
Or you can go and tell your family medicine doctors or your pediatricians to go ahead and start encouraging those conversations.
mm-hmm,
Mhm.
exactly, exactly. And especially because when you're young, Kind of like everything is new for you, but then when you keep on hearing the same information over and over again, even when you buy the doctor, then you understand a little bit better as well, because
Mhm. Mhm.
doctors tend to kind of like give you the how do you say it, the overall information,
Yeah.
and you don't have time to really go in depth into everything to explain how and what. So
Right.
yeah, yeah, that is true. How rewarding is your job?
Oh, I skip to work every day with a smile on my face. I love my job. Even though I hear some of the most traumatic stories, it never ceases to amaze me how resilient people are and how honored I am to hold space with them and just admire their developmental process, because coming
Mhm.
to a counselor doesn't mean that you're broken and you need fixing. It just means
Exactly.
you need a neutral person to kind of help you see the forest for the trees. And so I am happy to do that. I enjoy it. I think people are amazing, and I hope I can do it until I'm 100.
Yes, and I think you need to repeat that part again, that counselors are not there because you're crazy, but it's just to.
Yep. And especially to my guy clients, I'm like, I've seen a huge increase in men coming to counseling on their own in the last 5 years than I have in my entire 21-year career. And I'm ecstatic about it because it shows that the hard work is paying off, that we're getting the word out there, that it does not mean you are broken and you need fixing. It just means you need a neutral person to kind of help you see things. Perspective.
Yes.
Mhm.
Yes, exactly, exactly. Because over here it's still a little bit of
Stigma.
no,
A bit of a stigma.
yes,
Mhm.
yes, exactly. We're not going to talk about our problems. We're going to keep it inside. We're
Mhm.
just hoping to see what will come out of it. If it's bad, hey, yeah, but at least I didn't go out there and
Yeah.
nobody saw me going talk with the counselor.
Mhm.
So
Stigma. Stigma. We've got to change the conversation. We have to change the perspective.
yes, exactly. We're
Mhm.
having a question. What are some of the issues that men want to discuss?
Okay. I have a general practice as well as a reproductive health practice. So the issues that I see a lot of men wanting to discuss are dealing with stress, dealing with anger management, um, dealing with um, career changes, dealing with relationship stability. So, wanting to be a better partner, wanting to parent in a more positive, productive way, because a lot of times we were parented in a way that was because I said so. And I see a lot of men and women too wanting
Mm-hmm.
to do a better job of teaching instead of bossing.
Yeah.
So,
Mm-hmm.
mhm.
Yeah. Yeah. No, I was thinking I'm in that field, so yes, that
You see it,
changing
don't
the
you?
narrative of not wanting to boss, but more, yeah, that's
Our
something
job
we.
is to teach, not
Yes.
to punish or humiliate. And we can have positive discipline. And people don't realize, especially a lot of my guy clients are like, well, it's because I said so. And now I'm seeing a shift in that they really want a connection with their family and their children. So,
Mm-hmm. Yes, which is really important. Yeah.
and
So
on that note, real quick before I forget, um, dads get postpartum depression or anxiety as well. 1 out of 10 dads can have a postpartum mental health issue.
okay, that one I didn't know. So what? How do I have to imagine the postpartum depression then?
So 1 out of 7 moms and 1 out of 10 dads. So it could be anything from irritability to depression. For men, it mostly manifests as like anxiety and irritability. So.
Okay,
Mhm.
okay. So
Mhm.
and then in their cases, because a child was born and it changed their whole system and structure.
The whole dynamic of the relationship, the sleep deprivation is number one for men and women, for
Mm-hmm.
any parent, so same sex or not. The sleep deprivation is the main catalyst.
Okay, okay, that's really interesting to know.
Yeah.
Wow, I learned something new.
That's why I wish we would talk about reproductive health across the lifespan in the younger age groups, in the middle schools and in the high schools, because if the guys and the girls are hearing these things, once they get there, they're like, oh yeah, I remember us talking about that. And they'll have more compassion and
Yeah.
more willing to get help for it.
Yes, exactly. Indeed, indeed.
Mhm.
And I hope it's not that because now we heard that the postpartum depression in men is manifesting as irritability, that
Mhm.
whenever men are irritable, they'll be going and think that.
Your audience can look at PSI, Postpartum Support International, is one of my favorite resources for postpartum information for males and females.
You can repeat that again. Postpartum.
PSI, Postpartum Support International.
Okay,
Hmm.
I'm writing that down.
Okay.
Okay. Yes, because that's really something new that I didn't know about it. So it's good to look information about that.
Yes, that's why I'm so glad you're doing this. Educational piece is, even if just one person hears us talking and takes something and does some research, the impact that they can have on one person, five people, it just the ripple effect. So
Yes.
thank you for doing what you do.
Thank you, and thank you for being part of it.
Absolutely, I'm honored. I appreciate it.
And what are the different causes for infertility? And is there a difference between men and women?
Hmm. Like you and I discussed earlier, you have the physical aspects like sperm count, mobility, motility, and for us ladies, could be something with the uterus, something with hormones, something with the tubes being blocked. Um, so yeah, there's
Yeah.
quite a bit involved with that.
Okay. Okay. And most of them, especially when it comes, not especially, but when it comes to a woman, those are things that you can work on and solve.
Mhm.
Um,
That's a good point. So 85 to 90% of people go on to have happy, healthy pregnancies. So even if someone has had recurrent loss, so
mhm.
3, 4 miscarriages, the statistics are on your side. Most people still go on to have happy, healthy pregnancies.
Okay.
Mhm.
Okay. That is
Mhm.
nice. Well, I think we reached to the end of this session. And I would really love to thank you again a million times for your time. And like I said in all my posts before, this is first session of many, because I would love to have you back so we can go a little bit more in depth, for example, on the different diseases, and also the mental health aspect when it comes to this.
Yeah, because you can
So
see how we planted a bunch of seeds and like, whoa, that's a lot. So we could go off of several of those topics.
yes, exactly. That is so true. So Mindful Elevation wants to thank you. Is there a tip or few that you can give us as a closing of this session, or some maybe important information that you want to leave us go with?
So definitely do some research. I like for people to go to just a couple of really good reputable websites. So the American Society for Reproductive Medicine, Resolve, the National Infertility Association, and the other two that you and I talked about, like Sex Wise Parents and the Mama Bear Effect. Those are probably, oh, and the 5 love languages. Those are my top 5. So that way you don't go down the Google rabbit hole and just get lost. So
Yes,
stick to the
exactly.
simple ones. And Instagram, I mean, I post a lot on my Instagram page, which is Fertile Affirmations. And there's several people that I share their works that I think are phenomenal. So I really am all about information and sharing information. So if anybody needs anything, they can catch me there.
Yes, exactly. Well, thank you again.
Thank
And
you.
yes, thank you for the information. And I hope you enjoy your evening, and all the viewers as well. Thank you for being present. And if after you still have any question, please feel free. And Miss Wendy will be more than happy to explain or help you on
Direct
your
you
way.
in the right place. Yep.
Yes, correct. Thank you, everybody, and have a good night further. And I will see all of you next week again.
Bye, everybody.
Bye.